Okay, so ALS, also known as amyotrophic lateral sclerosis, is a degenerative disorder that affects the motor neurons in your brain and spinal cord. What this means is the nerves are in charge of motor function, so movement of your limbs are affected. So the cardinal signs, which are the main symptoms that people usually feel with this, is weakness in the extremities that are further away from you, so in your lower legs and your hands. So buttoning a shirt will be hard. A lot of muscle weakness in the fingers, so buttoning a shirt, doing things like pinching movements like grabbing a toothbrush to brush your teeth, things of that nature. Those are the first signs and symptoms that you would feel from this. Some people do present with muscle weakness in the face. It's usually asymmetrical, which means it's on one side. You might have trouble moving your tongue to that side. You might have issues swallowing, so you'll feel those symptoms as well. Depending on how far progressed the condition is, and also depending on what part of the brain has been affected and how long it's been affected, the symptoms will be worse. But they do start distal to proximal, which means from fingertips all the way to the center of your body. A lot of people with this condition also end up having weakness in the neck area. Unfortunately, there is no cure for it, but with physical therapy, it definitely helps to help you live a more comfortable life for longer. Because if you're not working out your body, you're not preserving that range of motion, then you're definitely going to lose it faster. So it definitely would help your quality of life, and it would help manage those symptoms going to physical therapy. Unfortunately, there's no known cause for this condition. There are risk factors associated with it, like working with harmful, like toxic materials, or being exposed to toxins. Also having an unhealthy lifestyle like poor diet, smoking cigarettes, excessive drinking. Trauma is also one of the risk factors. Genetics is another big risk factor. So there are some risk factors that, yes, you can help not prevent the disease, but make it less likely that you would be to get it. But as I mentioned, there's no known cause, so you could live the healthiest lifestyle and still get it. But with making these lifestyle changes, it will help you to be more comfortable throughout the process. Unfortunately, things like genetics are not something that you can control, and that is one of the most known risk factor for this condition. Onset is usually, I would, between 50 and 65, I believe, and it's most commonly seen in males than women. But again, it is degenerative, progressive, it gets worse over time, but through physical therapy, we can definitely help you manage those symptoms and live more comfortably.